Hi and welcome to yet another edition of Health Plus. In today's episode, we will discuss about infertility. Infertility is nothing but the inability of a couple to bear a child after a year of unprotected sexual intercourse. Infertility affects both men and women. Most infertility cases fall between 85 to 90%, are then treated through medication or surgery. The improved treatment modalities includes inverter fertilization, also known as IVF, and intracytoplasmic sperm injection, also known as ICSI. To discuss more on this, we have with us Dr.Parasuram Gopinath, who is the scientific director at CIMAR COCHIN. Doctor, welcome to Health Plus. Thank you for being with us. And can you tell us more what exactly is infertility?
Infertility basically means not able to conceive for the male and the female when they actually stay together for a year and they try for a year properly and they're not able to conceive, then it is called as an infertility and they need to go in for a treatment.
Is it only after a year or can it happen a bit?
See, basically what happens is, say when you look into statistics, a normal man and female, a completely normal man and female, if they try for a pregnancy for one particular month, the chance of them getting pregnant is only 20%. Mm-hmm. And even if they stay together for almost a year, only 80% of them conceive. So that is why just looking at 1 month or 2 months, we do not get into this thing that, oh, we are infertile and we need to go in for a treatment. But what is to be remembered is this is a group of patients where I'm talking about who are newly married, young patients. But imagine a patient who's getting married elderly, say 30 plus. Mm-hmm. The female age is the most important factor in infertility. And when the female age is beyond 30, then at that point of time, even after 3 to 6 months of trying generally for a pregnancy, and if they do not conceive, they need to come in for an infertility treatment.
So apart from the age, what exactly would be the cause for infertility in women?
Basically, in women, there are several causes of infertility. Age being one of the major factors of infertility, it basically decreases over as the age increases. And then there is, to be specific of female, there are several causes like something to do with the eggs. See, what happens is, why age is important is females produce eggs, mm-hmm. and that is what basically is required for a pregnancy. And eggs, the number of eggs in the female body keeps diminishing over the years. And beyond 30, it kinds of starts coming down in a higher frequency. Mm-hmm. So that is why we say that beyond 30 we need to have a more rigorous treatment for infertility. And it is not just the eggs. It's basically the eggs produced by the female and the sperms produced by the man. Mm-hmm. These has to meet each other. And all these things happen inside the women. So any problems in the root in which they meet, the sperm and the egg, like say there's a tubal block or mm-hmm. something in the uterus or some other problem which can actually cause an infertility.
With reference to infertility in men, is there an age barrier?
Currently, they say men are fertile throughout their life. They say they claim of until or something that they become impotent or they're not able to have sustained erection. But generally, the sperm quality is considered to be good throughout. Say, but beyond 55, they say there is a decrease in quality, but there's not much studies which have come into that.
Is there any surgery that can actually correct this?
No, basically there are a lot of surgeries. For example, like I said, if there is a tubal block, there are options available to remove the block via surgery. Or if there is any, there are things in the uterus is where the baby comes and holds on. Mm-hmm. Okay, if there is some kind of a mass or some kind of a lump in the uterus, that has to be removed. Okay. Or some kind of say there is the cavity has some kind of a blockage or something which can be removed, which can be done using a surgery. And the most commonest surgery available for all these things are done through laparoscopies. Mm-hmm. I think you must have heard of a keyhole surgery wherein yes. actually you put in 2-3 scopes and you can actually this is basically to understand if everything is normal, and even if there is an abnormality, we could correct all these problems through the same laparoscopy.
Are there any treatments like Ayurvedic, or is there any treatment that can actually correct this?
There have been a lot of studies being like allopathy or the kind of homeopathic treatments available, Ayurvedic treatment. But currently, there have not been major studies on it. A lot of things which actually come in saying that this is useful, but until we basically current eras of evidence-based medicine where you actually need to have evidence that this particular medicine is giving us products, you need to have a proper written evidence, and only according to that evidence we can act on it. Wherein for Ayurvedic and homeopathic and allopathic, we do not have not allopathic, sorry, we do not have that kind of evidence to actually act on it. A lot of people still do continue having Ayurvedic and homeopathic treatments for this.
If a woman has crossed her 30s, what are the chances of her being infertile?
See, obviously, it's just that your chances of fertility slightly comes down. That does not mean that they're infertile. What happens is when the female is not pregnant during that 20 to 30 years time, what happens is the female body starts developing certain kinds of diseases which come towards the end of the their age, like endometriosis, fibroids, and things which are more commonly seen in women beyond 30 years. So obviously, with all these things coming up, and also the number of eggs in the body slightly reducing, the chance of pregnancy obviously will come down.
What does the stats say in India? Is the infertility on the rise?
See, basically, it is the causes of infertility it's not rising. Actually, it is basically we going into the causes of infertility are rising. For example, see, late marriages or somebody who are not able to stay together, hectic schedules, they not able to be together for a long time. So these kind of things actually, it is basically the smoking, the more amount of alcohol, the junk food. See, all these things, it's basically we have more. These are all there before also.
Okay.
Is that our exposure to these have increased. So that is the reason why the infertility has risen, not because the reasons for infertility have risen.
Okay.